Hi, my name is Jennifer Byers. I'm the Executive Director of Life with Cancer and Patient Experience at the Nova Shar Cancer Institute. And today we're going to talk about sexual health after a cancer diagnosis. So what should you expect today? We are going to talk a little bit about sexuality and intimacy and defining those terms. We are going to dispel some common myths that I hear from folks on a fairly regular basis. Talk about the effects of cancer on intimacy, both from the treatment side and the emotional side. And I'm also going to offer some tips and ideas of how to really build your toolkit when it comes to sexual health. So what is the prevalence of sexual dysfunction? When we look at patients who've been diagnosed with a gynecological cancer, we see that 40 to 100% of patients experience sexual problems. And I think this number is important because I really want to normalize that this is a really normal side effect of the diagnosis. And there have been some studies that show that altered sexual functioning is actually the most compromised quality of life issue for patients. And so if you take nothing else away from this conversation, what I'm really hoping that you will know is that if you are experiencing issues with your sexual health, this is a really normal side effect. That doesn't mean that there's nothing we can do about it, but that you're not alone in that happening. So what is sexuality? Oftentimes when we think about sexuality, we think maybe it's just sex. It's not just sex. It really is the way we feel about ourselves as sexual beings. It's the way that we express ourselves. It can be expressed in many physical and non-physical ways. So that could be the clothes you wear, the way you move through the world. Cultural and religious values can often really play into sexuality, the way you have sex and who you have sex with. And all of these things can be impacted by how we are raised, experiences that we have had sexually, whether they're good or bad. Emotional connections that we're feeling or the relationship you have with the person you're engaging with sexually, and how you feel about yourself emotionally and physically in the moment. Cancer and its impact may be part of this sexuality, but it's not the biggest part. You come into this experience with a lifetime of what sexuality means to you, and cancer sometimes allows us to pause and rethink what that means. What's intimacy? Intimacy can be defined as this reciprocal relationship in which innermost thoughts and feelings are shared and can include areas such as sexual or emotional. You notice when I'm giving these definitions that I haven't used words like penetration or orgasm, these words that are so often the first things that come up for us when we are thinking about sexual experiences or when we're thinking about successful sexual experiences. So I'm hoping as we go through this presentation today that there's a real opportunity to kind of widen those definitions and widen your lens around good sexual experiences and intimacy. So why is sexual health important? I mean, I'm sure if you're in this talk, I probably don't necessarily need to tell you this, but sexual health can be important to us for a number of different reasons. This idea of sexuality can really help signify I'm alive, I'm a human, that I have acceptance or validation by a partner. It may be an important piece of feeling comfortable dating. And sometimes resuming sexual intimacy is one way of feeling that things are back to normal or more back to normal because oftentimes it may have stopped during and sexuality and intimacy are not necessarily thought of as life or death issues, but they really are very important quality of life issues. And so this is really an important piece oftentimes of who people are and how they think about themselves. And so really thinking about how to engage sexually after a diagnosis and feel comfortable with it can be a really important piece of a person's quality of life. So what are some of the myths that I hear? Sex is failure without orgasm. Sex has to involve penetration. So two of those that I've already started to play with as we started this conversation together. This doesn't apply to me. I'm single. My partner will think less of me. I'm less of a woman, or I'll never be able to satisfy my partner. These are all things that maybe they feel true in the moment, but are not true. And there are certainly ways around some of these myths that are here today. I also want to point out that it's not only about the body. Oftentimes when we think about sex, we get really caught up in the physical aspect of it. But the emotional piece is just as important, if not, I would say more important than some of the physical pieces. There are a few studies that I just wanted to quote here, and they're about breast cancer, but I think that they really can generalize to, all populations. This idea that increased relationship stress impairs arousal, lubrication, orgasm, and sexual satisfaction. I've never met anyone going through a cancer diagnosis that didn't have some increased relationship stress. So again, just this idea of kind of a normal reaction to a difficult situation. And that emotional involvement is really important for good adjustment after a cancer diagnosis. And so making sure that our caregivers, our partners, those people who are emotionally supporting us can be a really important piece of this equation. So what can the impact of cancer be on the sexual response? This certainly will be different for everyone, but I wanted to pick some of the highlights that I think a lot of people experience. Impaired sexual arousal can be something that I hear of a lot. And so that may show up as a lack of lubrication or dryness, a vaginal discomfort in women, a lack of subjective pleasure. This just doesn't feel like it used to. A difficulty reaching orgasm or not being able to reach orgasm, or it feeling differently, feeling not as intense. A loss of libido or desire. And again, this can come from emotional pieces or physical pieces, pain during sex. And a lot of these impacts are directly related to treatment. Maybe going into sudden menopause from chemotherapy or a needed surgery, hysterectomy, a vaginal shortening or tightening due to radiation or chemotherapy. These are all pieces that that we would not be surprised to see from someone who is going through cancer treatment. Other impacts of these side effects could result from surgery or a skin irritation. So maybe you had a certain part of your body that you really like to have touched, and now you have a surgical scar there, or the skin pools or feels a little different. Disinterest. It could be from fatigue, or it could just be from so much going on in life. Role changes. We know that when people are diagnosed with cancer, that there are significant role changes that happen, whether it's because you can't work in the same job you used to work in, or you are fatigued, and so you're showing up for the family in a different way than maybe you showed up before. Just the fact that if you have a partner and they're caregiving for you, that can change the dynamic of a relationship. Fear of recurrence adds a considerable amount of stress. Body image due to hair loss or scars. Anxiety and depression and the medications that we use to treat it can have an impact on sexual health. And increased smoking or alcohol can also have an impact. So I've kind of gone over what are some of the issues or what do we expect to see, but what I'd really like to spend some time on today is this idea of a toolbox. There isn't a one-size-fits-all approach. And so today I'm going to be kind of going over what some of the tips or tools that I know work for a lot of people. And some of these may work for you and some of them may not. I'm also going to give some suggestions on where to go to get some further help. I do always, when I talk about sexual health, I really like to talk about grief, because to me, those things often go hand in hand together. I think when you walk away today, my goal isn't to get your sexual functioning back to where it was before. And I think it's really important that if your sexual health has been impacted, that time is taken to grieve what is lost, to grieve what is different. And that's a really important piece as you start to maybe rebuild or rethink about what sex can look like in your life. But I'm not here to say that this is easy or even fun sometimes. But really this idea of, there has been something that has been lost. And so taking some time to acknowledge that. And then when you're ready, thinking about what are ways that your new body and your new ability to be sexual can be incorporated. So I want to start out talking about maintenance of vaginal health. I think this is something that's important to everyone, not just folks who have been diagnosed with cancer, but it becomes even more important when that's the case. It's important as we age to think about the maintenance of our vaginal health. There is a lot of truth to use it or lose it. And so this idea of if we are not having penetrative sex, how we maintain the health of our vagina, but also how we make sure that we are taking care of ourselves. I like the term vagina gym because I think oftentimes we go to the gym for our physical health, but there is this idea of a vagina gym for your vaginal health. And the importance of moisturizing, stretching, and strengthening is all part of that care. So when we think about vaginal moisturizers, there are a ton of different brands, and I've mentioned a few here and a few that do different things. But moisturizers are not lubricants. They're often something that you will insert into the vaginal canal, usually 2 to 3 times a week. Replens, Hylogyne, Reverie, Luvina, these are all different types of vaginal moisturizers. A lot of people like the ones with hyaluronic acid because that can really plump up the tissues that maybe are feeling thin or drier than normal. And this is something, again, that you do on a regular basis. Oftentimes, people who have had a hysterectomy or even pelvic radiation, it may be something that you're doing for the rest of your life. And so getting used to a routine that you feel comfortable with is important. And if you try one and you don't necessarily love the way it feels, you can certainly try another one. Vitamin E is also an option for this. Shifting a little bit to maybe to hormone replacement therapy, this is something that, always you want to start with your doctor first before you use hormone replacement therapy, but there's typically thought to be 2 different kinds: systemic, which would potentially be a pill that you take, and localized, which may be a cream, a ring, or a tablet that you insert directly into the vagina that can help with, again, the moisture and the tissues from loss of estrogen in the body. There is an FDA-approved pill as well, Aspina, that some people have found helpful. And so these are just kind of some options that can be helpful if you are feeling like you need more moisture, if you are feeling too dry to really partake in any type of penetrative activity. Another important piece is lubrication. And sometimes it's hard to know what type of lube you should use. There tends to be, I kind of think of it as 3 kinds: of water-based lube, silicone, or oils. There's also blends of these. But when we think about lubrication, we want a lubricant that does not have parabens, glycerin, propylene, glycol, a lot of these additives that can really be an irritant to the skin in an area that may already be a little irritated. And so some of the brands that do a really good job of using clean materials, Liquid, Good Clean Love, Uber Lube, Slippery Stuff, those are all brand names that people have used and found helpful and typically tend to have safe ingredients. Other things to think of when we're thinking about lubrication: water-based lubricants are great in that they're easy to clean. They can be used with condoms and sex toys, but they do dry out quickly. You can kind of reinvigorate them with a spray bottle of water. I don't know how many people want to be sprayed with water when they're engaging in sexual activity, but that is one way to kind of perk it up, and those are the options with water-based lube. Silicone is good in that it lasts longer, but it can be a little bit harder to clean. Sometimes it's more expensive. It is okay to use silicone with condoms, but you don't want to use it with silicone toys. So if you're using silicone dilators or toys, using a silicone lubrication can degrade the material and make it not safe. And then oil-based are kind of oftentimes those things we find at our home. It could be Vaseline, it could be olive oil, coconut oil, which a lot of times people use for moisturizers and lubrication. These are not good with condoms. These break down condoms, but oftentimes they're easily accessible. I did mention coconut oil, and when people oftentimes use coconut oil as a vaginal moisturizer, sometimes what they do is they fill up little ice cube trays with coconut oil, and then they'll insert it into the vaginal canal 2 to 3 times a week, again, to help with moisture. So that's another option. So what's the stretch part of our vagina gym? When we think about the stretch part, we oftentimes will think about sexual penetration or dilators or toys. These help us to maintain the length and the width of the vagina. Again, there are chemotherapies and radiation, hysterectomy, different impacts of surgery that can impact the integrity of the vagina. And so using dilator therapy can really help with keeping the skin stretched out. It also can help with psychological anticipation of pain. So if we are worried that sex is going to hurt, we're oftentimes going to tense up our muscles. And so using dilator therapy or a toy to practice penetration or use penetration on a regular basis can help with actual penetration, because you, as you're doing this therapy, have more control over the speed, over the size, and over the experience. Dilators can also be a really good tool. I realize I spelled dilators wrong. Dilators can be a really good tool to learn to relax muscles, which is an important piece of enjoyable sexual activity. It can be especially important after pelvic radiation, and usually recommended 3 times 10 to 15 minutes a time. And so again, this is something that if you're not having regular penetrative sex, that you're going to want to do on a regular basis. I always recommend that folks find a calm place to do this, that using a mirror can be really helpful at first. And I think using a mirror just to get to know yourself can be an important piece of good sexual health, but also as you are doing dilator therapy, this can be important. Lubrication is really important. So we just talked about maybe some of the potential lubricants that you can use, but using a lubricant is really important. This idea of practicing your breathing and not holding your breath can be an important part of dilator therapy. Using Kegels or tensing your muscles and releasing them before you start dilator therapy can be helpful in just teaching your body what it feels like to tense your muscles and what it feels like to release your muscles. This can be helpful, one, in inserting the dilator, but also if you move to penetrative sex, it can be a good mind-body connection of how to tense and relax those muscles so that as you're breathing through a sexual experience, you're making sure that you're not holding those muscles tight. You always want to start with the smallest dilator. And I think this is important to say, because sometimes women will come in and, they'll say, I started with the biggest one, it was really painful. And it's really important that you start with the smallest one. And then once you've done that a few times with no pain, then you can move up in size. And you can move up in size slowly, one size at a time. If you have pain, it's always recommended to stop. Discomfort may be normal. When you move from size to size, you may have discomfort. And so again, going back to that breath and breathing through and relaxing those muscles can be important. But if it's painful, it's good to stop. And that may be a time when we want to involve a pelvic floor specialist or a doctor who specializes in sexual health so that they can really look and see what's happening and maybe make some specific recommendations. All right. I wanted to talk a little bit about orgasm interventions because I did speak earlier about how orgasms can change through different treatments, whether it's the intensity or the ability to have an orgasm or it just feels different. Masturbation if it's something that you feel comfortable with, if it's culturally or appropriate with your religion, is a really good evidence-based practice to learning how to orgasm again, or to learning what feels good to you. I think anytime after a cancer diagnosis, we have to relearn our bodies, and masturbation can sometimes be a good place to start because there is not the pressure of partnered sex. Vibrators can be helpful. Maybe before you had cancer, you didn't need to use a vibrator, but a vibrator can help enhance sensation. It can be used for solo sex, but also can be incorporated into partner sex. Again, this idea of mindfulness techniques, staying in the moment. It is really hard to orgasm if we're thinking about laundry or the bills that need to be paid. And so using mindfulness to really stay in the moment can be important. And then sexual fantasies, visuals, using auditory or actual looking at material can also be helpful when we are thinking about getting back to a space where we're able to orgasm. Other helpful items that I just wanted to make sure I mentioned. Again, vibrators can be an important piece of this toolkit. There's also clitoral vacuum therapy. This can be helpful to bring blood to the clitoris and can be an important component of healing. There is one FDA-approved tool called the Eros. There's a picture of it there, and can be an important part of the healing process. The ONA is also a really neat tool that I often recommend to people, especially if you feel like that you're having pain with intercourse because of vaginal shortening. The ONA, if you see in the picture, comes in different pieces, and it's something that you can put on the penis that won't allow it to insert any further. And so if there is a fear of pain, this can be a really great tool that allows a person to control the depth of whatever is being inserted. And then another important piece is positioning. So it may be really important to try different positions that you have more control in, positions that can control depth, positions that allow you to be positioned in a way that make you feel sexy or more beautiful. All of these can help lead to better sex when we're thinking about that. Whenever you are confronting sexual issues, I always like to mention the importance of finding a team. Oftentimes, this is not something that we can just figure out alone or bear and grit our teeth through. And so identifying members of the team that can help with your sexual health are really important. Oftentimes, it's not your oncologist. Oncologists are incredible at treating cancer. They aren't always experts in sexual health and how the treatments may impact your sexual health. So oftentimes I'm suggesting to women that they find a good urogynecologist. Pelvic floor therapists are oftentimes my best friends. They, whereas I, as a sex therapist, can help with the emotional support, it's harder sometimes to see what's happening physically. So a pelvic floor therapist can actually teach you how to use the dilators by inserting them with you and going through what that could look like. They can also check the vaginal walls for tight spots or any issues and give you some exercises and tools that you can use at home and with them that can really improve the experience. An endocrinologist is oftentimes important. Sometimes a urogynecologist can do the testing that's needed. Sometimes an endocrinologist is more helpful. And so sometimes checking hormone levels and seeing what options may be around there. And then a sex therapist, because like I mentioned, even though oftentimes these issues start out as physical issues, there's always emotional ramifications for a diagnosis and when our sexual health is impacted. And so finding someone that you can talk to about that you can kind of go through the different tools in your toolbox and think about more creative ways to use it can be really helpful, either for an individual or a couple. So I want to transition a little bit and talk about desire, because I think desire is oftentimes a really important part of sex and can be a little elusive. Oftentimes we assume that desire to have sex is innate and healthy, but that context in which desire happens is often not considered. And the context is so important. And when we think about sexual desire, it's not only something that you feel prior to sex, it can often be your wish, your motivation, your physical urge to engage in sex that hopefully proceeds and continues throughout a sexual encounter. Arousal and desire are certainly not the same thing. And so when we think of desire, I want to want sex, that in itself is desire. Oftentimes we think that desire has to be arousal. It's not that, and oftentimes it's very complex and requires our thoughts, emotions, and bodies to work in sync, and that can be really hard. I just like to show this graph because I hope that you can see it in a circle that sex really isn't linear. It's not that we have desire and then we have arousal and then we have sex and then we orgasm and then we end. Really, there is not a linear process to this, but really a loop that sometimes desire can lead to arousal, sometimes arousal can lead to desire. Using physical touch can be very important. And I think we're taught a lot that we're supposed to have this spontaneous desire and that we should just, wake up with desire. But what inspires sex at 20 is very different than what interests us at 50. And it's really important to figure out over time what can contribute to your desire, knowing that this will change over a lifetime. Oftentimes, as we age or have physical issues, more explicit sexual stimulation is needed, and this can be a really important piece. And so changing how we think about desire or how we think about sex can be important in how we're able to access it. I did want to take a minute and just talk about how depression impacts desire. We know that when people are diagnosed with cancer, that there's a stronger likelihood than the normal population that they will experience depression. And we also know that depression can impact desire, and the antidepressants that we take for depression can impact desire. They can also impact orgasm. And so knowing this can be important. And sometimes it's hard to know if it's the medication that's impacting sexual experience, if it's the depression. And so if it feels appropriate, sometimes people will talk to their doctor about a dose reduction or a medication change if it feels like it's coming from the medication. But things that are worth paying attention to. It's also important to know the difference between fatigue and depression, because fatigue is such a symptom that is so prevalent in people who have been impacted by cancer. One way to do this is to think about, can you imagine doing something you enjoy? And does it feel like that would be something that if you weren't so fatigued, you'd want to participate in? Do you enjoy spending time with people, even though you may be tired? And again, this is another place that a therapist could really be helpful to help tease out the difference between fatigue and depression, but both can really have a significant impact on sexual health. Self-esteem is another important issue that can impact desire, and this can be changes in body image that come from different treatments. There's a lot of different ways to think about self-esteem and to work with self-esteem. And unfortunately, we don't have a lot of time to spend on this today. But I think one tip that can be helpful is really to think about, who are you now? What about who you are now is important to you, makes you proud. That may be different than who it was before. And working on positive affirmations and really focusing on positive things can be helpful in working with changes for self-esteem. This is oftentimes another area that really, takes some grief work and really takes some time to acknowledge the losses and then to start to move forward and think about how those can be reframed or what are some of the positive aspects of that. So when we think about desire, some questions that may be worth asking. In what situations, if any, do I feel desire? Do you feel it in the middle of lovemaking, when you're apart from your partner, when you watch a sex scene in a movie or swipe right on a cute person? Is there anything that can help that you notice that you're feeling desire? And maybe something completely not sexual. So those are things to think about as well. When you experience desire, what comes next? Do you act on it? Do you feel ashamed or embarrassed? Why is your disinterest in sex a problem? I think this is always a really important question to ask ourselves, because sometimes it's not a problem, and sometimes it is a problem. And so really understanding that now. And if you're having trouble figuring out how you experience desire now, sometimes thinking about it the time in the past can be really helpful. Another kind of journaling activity that I think can be helpful as we start to explore this area of desire and explore kind of where we are with it are these two phrases. I turn myself off when, and I turn myself on when. So there's this idea of sexual accelerators and sexual brakes. And oftentimes our sexual brakes can get in the way of being turned on and being having desire or arousal. We turn ourselves on when we energize ourselves, when we are embodied and focused. And so this could be dancing, this could be being out in nature, it could be doing something that you feel like you are able to master. And so really paying attention to what these things are and incorporating more of them in life can be important. And really knowing what are the things that turn you off. And when you can change those things that can turn you off, that's good. And if you can't, really using this idea of mindfulness or being fully present to be in the moment can be important. Another key piece in desire is this idea of widening the realm of the senses. Esther Perel just had a great blog post out about incorporating eroticism into your self-care plan. And I really loved this list of questions. I won't read them to you, but I think that they are an important way to start thinking about how do we utilize all of our senses, and how can we use our different senses to really come into our sexual or erotic self. A lot of these questions are really outside of what we think of in traditional sex, but I think they really are central ideas of experiencing and moving through the world. I wanted to quickly hit on a few other topics that I think are important. Pain and fatigue. We've talked about some of the things that go into pain and fatigue, but I want to mention them specifically because I think oftentimes when people are experiencing pain, sex can get taken off the table. And I don't know that that should always be the case. I think if it's not important to you, that's okay. But if it is important to you, finding a way to work with that can be important. So planning for the time of day when pain is the weakest or when you're most refreshed or energized can be important. Using pain medication a half an hour prior to intercourse. This idea of using positions or pillows or a way of repositioning yourself can be really important. These deep breathing or relaxation techniques that I mentioned before, foreplay or massage, using time to just be naked. I'm going to talk about sensate focus exercises in just a minute. Really redefining sex. And I think, even for people without pain after a cancer diagnosis, it's important to redefine sex and set expectations. And this idea of improved communication can be really important. So we talk about communication. I think a lot of us are raised in a society where we don't necessarily talk about sex, and some people are better at it than others, but it's always important, and it's especially important when you've had significant physical changes. And so here's some tips that maybe could be helpful when talking to your partner about sex. Really talking to them about what's happening with your sex life, your thoughts and beliefs, how it makes you feel, and what can make it better. I'm going to give an exact example of this because I think that's helpful. But the idea is really to avoid blame, which can help folks not get defensive and really be able to listen. So one example of how this type of communication works is we've made love only a few times since my cancer treatment. That's the fact that you're starting with. I think it may be because you're afraid of making me feel uncomfortable. That's your personal belief. So, using it from your perspective. When we don't have sex, I feel lonely and I miss being close to you. So those are some feelings around that. And then the needs. I feel better if we have sex more often and if it was your idea more often. So really presenting this in a way that that pulls in different styles of communication to help be really clear when you're talking with a partner. Other tips, these are normal communication tips, but they work really well in the sexual health realm as well, is to repeat what your partner says in your own words, ask questions to show interest and caring, saying things like "you seem worried" or "I'm sure this is hard for you," and listening and focusing. And this presentation is designed for people who've been diagnosed with cancer, but these same tips will work for our caregivers. So if we have any caregivers watching as well, they can use these same tips in communicating with their partner because that communication goes both ways. It's really important. So I mentioned sensate focus, and you could have a whole class on sensate focus, but sensate focus is this is really about touching and being present with one another. It takes penetration and orgasm off the table to start. And so it's a way to be physically close and intimate, really without the pressure or anxiety that can sometimes come with the expectations around sex. Usually you have one partner start and the other partner will use different touching, pressure, and just touching different parts of the body. It's okay if there are parts that are off limits. So if you have a scar that you don't want touched, or if there's a piece of your body that you don't feel comfortable having touched, you can communicate that beforehand and make that off limits. Again, touching genitals is generally off limits when this starts. There's no anticipation of penetration or orgasm. It's really just this idea of being intimate and using touch. And generally one person will go in the partner and they'll be touched for 10 or 15 minutes and then they'll switch. And I think after that, it's nice to talk about what surprised you, what felt different than you expected, what felt good, what didn't you like. And this is a really great tool, again, to take pressure off the table, but to get to know bodies that may have changed over time. And then just a few tips as we kind of round out our time together. I've mentioned this idea about finding other ways to be sexual, but I think creativity can be one of the most important things. We all have these expectations. Maybe we've used the same things over and over during sex, but now may be a time where you really have to be creative, think outside of the box and redefine what it means to be sexual. Going slowly at first can be important, and that all goes with communication. When we're able to set expectations, it can help really lower that anxiety that may come up. Create a sensual mood. Maybe that is lighting, maybe it's music, maybe you have candles lit, but this idea of entering back into the dating world. We say, we think that when we were in our 20s that we didn't need a lot of foreplay or we didn't need a lot of anything to create desire, but that's oftentimes not true because we may have been anticipating something excitingly in our head or planning a date or putting on a special outfit. And that may not happen as much as we get older. And so really kind of going back into creating this foreplay, which may be actually physical foreplay, but could be foreplay in sexy messages that you send each other, or scheduling these dates or these sex, which can sometimes really add to the excitement. Finding ways to be more sensual, just using touch in everyday life, and then not being afraid to talk about your worries or your fears. That can be an important piece. So appropriate timing of activity may help increase enjoyment. You really want to focus on the pleasure that you do experience instead of really focusing on what has changed or what's different. Communicate about your needs. Rest during sex, it's not a marathon. Again, this idea that we're not just trying to get to orgasm, but the entire experience is part of the sexual experience. And that if orgasm happens, great. But if it doesn't happen, there was a whole amount of time before that that was really important. There are other forms to intimacy outside of sex. That patience and a sense of humor is so, so important. You are going to try things and you're going to need to be able to laugh at yourself because I don't need to say this, but sex doesn't happen like it does in the movies. And it happens even less like that after we have physical changes like a cancer diagnosis. And so really looking to find some humor in the creativity can be important. Pleasure is possible. Pleasure is always possible. It may look different than it looked before, but it's not something to give up on. That this idea that change is work, like thinking about what do we work for in our life, whether it's our kids, our friends, our exercise. Sex is the same thing. Sexual health is the same thing. It may not come as easy as it came before, but if it's something important, it's worth the work. Relearning your body. Again, trying not to prioritize getting it done, but exploring those hidden desires and befriending our body, making peace with the shifts and the changes. Skin is our largest sex organ. We all still have skin everywhere, and the brain is the most important. And so really knowing that it is still very much possible to have pleasure from sexual activity and intimacy, even after a cancer diagnosis. It's just going to take really trying all of these different tools, getting new tools into your toolbox to really explore and see what the possibilities are. Thank you.